14 silent signs of prediabetes you should never ignore. It can still be reversed. Do you feel tired for no reason? Are you always thirsty or hungry even after eating? These could be signs that your body is trying to tell you something important. Today, we're going to talk about a condition that may be affecting millions of people without them knowing: prediabetes. Yes, it can be stealthy, but we're here to help you spot the 14 early signs that may indicate your blood sugar levels are higher than normal. At the end, we'll tell you the main steps you need to take to prevent developing diabetes, as prediabetes can be reversed. So stay tuned and let's get to the information. Sign number 1: excessive urination. In people with prediabetes, insulin resistance prevents cells from properly absorbing glucose from the bloodstream, leading to elevated blood glucose levels. Since our kidneys have a limited capacity to reabsorb this glucose, they end up excreting some of it, which is eliminated through urine. The presence of glucose in the urine creates an osmotic effect, drawing water into the renal tubules. This makes it difficult for the kidneys to reabsorb water normally, resulting in an increase in the volume of urine produced. This means the person ends up urinating more frequently throughout the day. And this is directly related to the next sign on our list. Sign number 2: dry mouth and excessive thirst. When you urinate more frequently throughout the day, more water is lost through urine, which can lead to dehydration. Since our body has intelligent mechanisms, when it realizes that too much water has been lost, it triggers a sensation of thirst, signaling that we need to drink more water to replace what was lost. Additionally, dehydration can also lead to a decrease in saliva production, causing a dry mouth sensation. Therefore, if you drink the recommended amount of water and still feel excessively thirsty, see your doctor to get checked out and take preventive measures against diabetes. Sign number 3: excessive hunger. In prediabetes, the body's cells have difficulty responding properly to insulin, the hormone responsible for transporting glucose into the cells to be used as energy. This difficulty in using glucose as energy can lead to a constant feeling of hunger, which is a mechanism used by our body to try to compensate for the energy deficit. Additionally, insulin resistance can deregulate the hormones that control appetite, such as leptin and ghrelin, which can lead to an increased feeling of hunger even after meals. Sign number 4: slow healing. This sign often goes unnoticed by people. After all, it's not often that we have a wound to observe its healing. In people with prediabetes, elevated blood glucose levels can damage blood vessels and decrease blood flow to injured areas, leading to poor circulation. This, in turn, can result in an inadequate supply of nutrients and oxygen to the cells surrounding the wound, delaying the healing process. Prediabetes can also compromise the immune system, making it less effective at fighting bacterial and other infections that may occur around the wound, meaning it takes longer to heal. Sign number 5: fatigue. Due to insulin resistance, cells may not receive the appropriate amount of glucose to produce energy, which can lead to fatigue and a feeling of weakness. The cells do not receive the fuel they need to function properly. Additionally, insulin resistance can also lead to hormonal imbalances, such as changes in cortisol levels and other stress-related hormones, which can contribute to fatigue. People with prediabetes may be more prone to sleep disorders, such as sleep apnea, which can interfere with sleep quality. And as we know, a lack of restorative sleep can lead to daytime fatigue. Another factor that can lead to fatigue is chronic inflammation, a condition that is commonly present in people with prediabetes. Sign number 6: blurred vision. Elevated blood glucose levels can cause changes in the shape and function of the lens of the eye, making it temporarily less flexible. This can make it difficult to focus clearly, resulting in blurred vision. In some cases, chronic hyperglycemia can lead to fluid accumulation in the central part of the retina, known as diabetic macular edema, which can cause blurred or distorted vision. Hyperglycemia can also damage the small blood vessels that supply the eyes, leading to circulation problems that ultimately affect vision. Additionally, people with prediabetes are at increased risk of developing other eye diseases, such as cataracts and glaucoma, which can also contribute to blurred vision. Sign number 7: frequent infections. Prediabetes can compromise the immune system, making it less effective at fighting bacterial, viral, and fungal infections. This factor can result in a higher frequency of infections. The gums are a commonly affected area, as the high concentration of glucose in the blood can increase the amount of glucose in saliva, creating a favorable environment for the growth of bacteria in the mouth, leading to gum infections. These infections can take a long time to improve, as poor blood circulation associated with prediabetes can reduce the transport of the body's defense cells to the infected areas. Additionally, excess glucose in the urine can provide a favorable environment for urinary tract infections. Sign number 8, tingling and numbness in the extremities. Chronic hyperglycemia can damage the small blood vessels and peripheral nerves that control sensation and movement in the extremities. When peripheral nerves are damaged, a person may experience decreased or lost sensation in the extremities, causing tingling, numbness, and a burning sensation. Nerve damage can also cause neuropathic pain, characterized by sensations of burning, stabbing, or electric shocks in the affected extremities. Some people often report a burning sensation in their feet when they lie down to sleep at night. Sign number 9, lack of concentration. In people with prediabetes, insulin resistance can lead to fluctuations in blood glucose levels. When glucose levels are too high or too low, this can affect brain function and impair the ability to concentrate. Elevated blood glucose levels can damage the blood vessels that supply blood to the brain, compromising cerebral blood flow, which can affect cognitive function by decreasing the ability to concentrate. And as we've seen, high blood glucose levels can also lead to fatigue and general malaise, making it difficult to concentrate and impairing performance in any activity that requires thinking. Sign number 10, unexplained weight loss. In the state of prediabetes, the body becomes ineffective at using glucose as an energy source, which can lead to the breakdown of fat and protein stores to provide energy, resulting in weight loss. Additionally, as the body begins to excrete more urine, weight loss can occur due to dehydration. After all, our body weight is composed of approximately 60% water. In some cases, insulin resistance and fluctuations in blood glucose levels can lead to a decrease in appetite, resulting in reduced caloric intake and weight loss. So always keep an eye on your weight, as significant and unexplained changes can signal the development of prediabetes. Sign number 11, erectile dysfunction. Insulin resistance and hyperglycemia can negatively affect blood flow to the penis, making it difficult to achieve a satisfactory erection. This is because prediabetes can cause nerve and blood vessel damage due to high blood glucose levels. Over time, this damage can interfere with the nerve response and blood flow needed to achieve and maintain an erection. Additionally, people with diabetes may experience changes in hormone levels, such as a decrease in testosterone levels, which can contribute to erectile dysfunction. Since erectile dysfunction is also related to cardiovascular problems, it is important that a healthcare professional investigates the origin of the problem to adopt the appropriate treatment. Sign number 12, acanthosis nigricans. This is a dermatological disorder that causes the darkening of the skin in certain areas of the body, such as the neck, armpits, elbows, knees, groin, and finger joints. Prediabetes can contribute to the appearance of acanthosis nigricans due to elevated insulin levels in the blood. Excess insulin can stimulate the growth of skin cells and increase the production of melanin, the pigment responsible for skin color. This leads to abnormal darkening and thickening of the skin in the affected areas. This darkening of the skin usually appears gradually, so it may not be noticed until the skin is quite darkened. Sign number 13, increased abdominal circumference. An increase in abdominal circumference is an early sign of prediabetes. Abdominal fat is metabolically active tissue, meaning it can release inflammatory substances and hormones that promote insulin resistance. Over time, the accumulation of abdominal fat can deregulate glucose metabolism and contribute to increased blood glucose levels. Abdominal fat can also interfere with the normal function of the liver and other metabolic organs, which can further increase the risk of developing prediabetes. Additionally, insulin resistance tends to promote fat storage in the abdominal region, contributing to an increase in abdominal circumference. Regular measurement of abdominal circumference can be a useful tool for monitoring health and preventing metabolic diseases. Sign number 14, difficulty sleeping. People with prediabetes may experience difficulty sleeping due to hormonal imbalances caused by insulin resistance. Additionally, hyperglycemia can lead to frequent urination during the night, which disrupts sleep and makes it difficult to fall asleep. Prediabetes is also associated with sleep disorders such as sleep apnea, which is characterized by interruptions in breathing during sleep. These disorders can affect sleep quality and lead to daytime fatigue. Insulin resistance can also affect the production of serotonin, a neurotransmitter related to mood and sleep regulation. Chronic inflammation associated with prediabetes can cause changes in the central nervous system, which can contribute to sleep difficulties. These signs may appear individually or in combination, and it is crucial to be aware of them, as early detection of prediabetes can make a difference in preventing diabetes. Remember that prediabetes is reversible, and with lifestyle changes such as healthy eating, regular physical activity, and weight loss, it is possible to normalize blood glucose levels and prevent the development of type 2 diabetes.